Yes, let's look at it. They have
Hello,
yes.
good morning, Mrs. Meisya. Hello, good morning, Mrs. Meisya. How are you feeling today?
Good morning, nurse. I'm feeling a bit better, but my head still hurts.
I'm glad to hear that you're improving. Did you sleep well last night?
Not really. I woke up several times because of the noise from the hallway.
I'm sorry about that. We have some maintenance work going on. Have you taken your medication this morning?
Yes, I have already taken it about an hour ago.
Good. The doctor visited your yesterday, right?
Yes, he did. He said that if my condition continues to improve, I will be discharged in 2 days.
That's great news. You've been here for a week, haven't you?
Yes, I've been staying here since last Thursday.
Well, keep resting and drinking lots of water. I will check your blood pressure again this afternoon.
Thank you, nurse. I really appreciate your help.
You're welcome, Mrs. Meisya. Get well soon. Good morning, Mrs. Meisya. My name is Muthia. I'm the nurse caring for you today. The doctor has recommended an appendectomy, which is a surgery to remove your appendix. I need to explain what will happen, the risks and benefits, and answer any question you may have. Is that okay?
Yes, that's okay.
The benefit of this surgery is that removing the infected appendix will prevent if the bursting and causing a more serious infection. The risks include bleeding, infection, or reacting to anesthesia. These are uncommon but possible. An alternative will be treated with antibiotic, but that may not completely solve the problem. Do you have any question?
How long will the recovery take?
Usually, you may feel some soreness for a few days. Most patients can go home within 2 or 3 days and return to normal activities in about 1 to 2 weeks. Can you tell me in your own words what you understand about the surgery?
You will remove my appendix so it doesn't burst and I might have some pain afterward.
That's right, Mrs. Meisya. Do you agree to this surgery?
Yes, I agree.
Thank you. I will record your consent and let the surgical team know. The doctor and the nurses will do their best, so please don't worry. If you need any help, please press the call bell beside your bed.
Thank you, Nurse Muthia. I feel more at ease now.
You are very welcome, Mrs. Meisya. We'll take good care for you.
Good morning, Miss. How can I help you today?
Good morning, nurse. I'd like to make an appointment with the doctors.
Sure. What time would you prefer?
Is there any available slot on Monday morning?
Let me check. Yes, we have one at 9 a.m. on Monday.
That's perfect. I have been having this science last week, and they usually happen at night.
I see. Have you taken any medication for the pain?
Sometimes I take painkiller, but they don't always work.
Alright. Please come 15 minutes earlier for the station.
Sure, thank you, nurse.
You're welcome, Mrs. Muthia. See you on the Monday at 9 a.m. Good afternoon, Mrs. Muthia. How are you feeling today?
Good afternoon, nurse. I still have a bit of pain in my stomach.
I see. The doctor prescribed some medicine to reduce you pain. I'll give it to you now.
What kind of medicine is it, nurse?
It's an analgesic tablet. It helps relieve pain and makes you more comfortable. Please take it after your meal to avoid stomach irritation.
Alright. Are there any side effects?
You might feel a little sleepy, but that's normal. Please avoid driving or doing heavy activities after taking it.
Okay, nurse, I'll be careful.
Great. Here's a glass of water, and please take a tablet slowly.
Done, thank you.
You're welcome. I'll come back later to check your condition and pain level. Please press the call bell if you feel worse.
Good morning, Mrs. Meisya. How are you feeling today?
Good morning, nurse. I'm still a bit scared to walk after my surgery. My leg feels weak.
I understand. It's completely normal to feel that way after surgery, but walking a little every day will really help your recovery faster.
Really? I'm afraid it might hurt again.
I'll be right beside you, so you won't be alone. I'll make sure you're safe and comfortable.
Oh, that's make me feel better, nurse.
You're doing great already. Many patients in your condition have recovered well, and I'm confident you will too.
Okay, I'll try to take a few steps then.
That's wonderful. You are showing great progress, Mr. Meisya. Remember, every small step today makes a big difference in your recovery tomorrow.
Thank you, Nurse Muthia. I really appreciate your support.
You are every welcome. I'm proud of you. Keep going at your own pace. Nurse, can I have another painkiller? The pain still comes back sometimes.
I understand this is Mutia. You've been really strong and patient during your recovery. I can see how well you've managed the pain so far.
Thank you, nurse, but I still hurts when I move my arm.
I'm really sorry to hear that. However, I'm afraid I can't give you another dose right now because it's not time yet according to your schedule. Taking too much could be harmful.
Oh, I didn't realize that. I just wanted the pain to stop faster.
I completely understand. Instead, I recommend using a warm compress and doing light breathing exercise. They can help ease the pain naturally.
Okay, I'll try that.
That's great. You've been following the instructions so well, and that's helping your recovery a lot.
Thank you, Nurse Meisya. You always explain things so clearly.
You're very welcome, Mrs. Mutia. I'll come back in 30 minutes to check on you again, alright?
Sure, nurse. Thanks for taking care of me.
Good evening, doctor. Am I speaking with Dr. Mutia, the doctor in charge of Mr. Rian in the Dahlia ward?
Yes, this is Dr. Muthia speaking. Who was calling?
Good evening, doctor. This is Nurse Meisya from the Dahlia ward. I'd like to report about Mr. Rian, a 32 years old, post-operative patient.
Alright, please go ahead.
The patient underwent an appendectomy 2 days ago. This afternoon, he developed a high fever of 39.2 degrees Celsius. About 15 minutes ago, he became drowsy and less responsive.
Oh, I see. Please continue.
His blood pressure is 95 over 60 millimeter of mercury, pulse rate 108 beats per minute, respiratory rate 24 per minute, and oxygen saturation is 94% on room air. His surgical wound looks swollen and warm to touch.
Understood. What action have you taken so far?
I've elevated the head of the bed and started 500 ml of normal saline infusion as previously prescribed. However, his temperature remains high and his condition is still weak.
Alright, please give paracetamol 1 gram IV infusion in 100 ml of normal saline after 50 minutes. Also, send blood and wound culture for examination. I'll refer the patient shortly.
Copy that, doctor. May I confirm the medication name, please?
Yes, please go ahead.
If the medication is paracetamol, spell it is Papa, Alpha, Romeo, Alpha, Charlie, Echo, Tango, Alpha, Mike, Oscar, Lima.
That's correct. Paracetamol 1 gram IV infusion in 100 ml of normal saline over 50 minutes.
Alright, doctor. I administer paracetamol 1 gram IV infusion and send the blood and 1 cultures right away.
Very good. Please monitor his temperature and blood pressure and let me know if his condition worsens.
Understood, doctor. I'll report back if there are any change.
Okay, thank you, Nurse Meisya.
Thank you, Dr. Muthia.